too late.
Do we need mom?
Where's mom? Marissa.
Marissa may need to step off to the side after she's done talking because it might be a little hot. Yeah.
She's coming.
I always wear the wrong shoes with grass. How are you doing? I perforate. I help nature.
You're aerating the grass.
So now I'm coming through here.
I love this backdrop. Yeah. Jungle.
Okay.
Good morning, everyone.
Thank you.
We are very pleased to be here today on this wonderful sunny day here at Lucille Packard Children's Hospital. I'm Paul King. I'm the president and CEO of the hospital. It is my honor and privilege to welcome a dear friend, someone who's been supporting children for many, many years, dare I even say decades, in terms of what we do, in terms of making sure that our community is cared for. Congresswoman Eshoo is with us today to share some thoughts around some legislation that she's proposed that's going to make it even better for kids. So without further ado, I turn it over to the Congresswoman.
Well, thank you very much, Paul, and it's wonderful to be here at Lucille Packard. Thank you for the guests that are here that I will introduce. Today, I think, is an important day because we want to discuss an issue of utmost importance, and that is pediatric cancer. Tragically, pediatric cancer is the second leading cause of death among children ages 1 to 14. When a child is diagnosed with cancer, the cancer obviously affects the entire family. Everyone's life is upended. But with treatment and care from extraordinary physicians like those here at Packard, at this extraordinary place, led by Paul King and his entire team, children can beat the cancer. Thanks to new treatments and cures from the bench top to the bedside each year, the 5-year survival rate today among children is now more than 85%. That's really an extraordinary number because each one is a precious human life. But there's more work for Congress to do to ensure that every child has access to treatments and therapies for cancer, and I've introduced 4 bills, 3 of which are bipartisan, to do just that. First, the Pediatric Cancer Drug Supply Act. It directs Health and Human Services, HHS, to establish a program to create a 6-month reserve of supplies of essential pediatric cancer drugs. Drug shortages, everyone here knows it, but I don't think the general public does. Drug shortages hit a 20-year high last summer, with more than 300 drugs currently in shortage, including critical oncology drugs used to treat childhood cancer. So today, a child that has cancer, these drug shortages can upend their treatments. Their families notified, don't bring your child in for the treatment because we don't have the drugs. My legislation will ensure that children and families aren't left scrambling when drugs are in short supply. Children should also benefit from advancements and innovations in treatments for cancer and rare diseases. That's why I've introduced the Give Kids a Chance Act and the Innovation in Pediatric Drugs Act. Both pieces of legislation are directing to close the loopholes that prevent children from benefiting from combination therapy. Today, the FDA does not have the authority to direct clinical trials involving a combination of drugs or to require drug companies to study closed. We can't know whether a drug will work for children if we don't test it. And both bills will fix this. The Creating Hope Reauthorization Act incentivizes companies to develop new pediatric cancer drugs by providing vouchers. And this can be really a highly effective tool to speed reviews by the FDA of new drug products. The legislation, I think, can save children's lives. I'm so grateful to Stanford Medicine Children's Health and the Children's Hospital Association for supporting these bills. When bills are introduced and we circulate them to the entire House of Representatives, members always look to see who supports the legislation. And with both of these organizations supporting these bills, this gives the legislation an enormous boost. Why? Because they're blue chip organizations, and we know that right here at home. For more than 30 years in Congress, I've had the privilege of representing this state-of-the-art facility, all of its people, and the families that bring their children here. So I will fight very hard in my last year of Congress to get these bills over the finish line and come back here to celebrate with all of you the passage because it's going to make a difference in children's lives. First, I want to call to the podium Mr. Matt Cook. He's the CEO of the Children's Hospital Association, and speaking of blue chip organizations, this is one of them. Chris Dawes, a former CEO of Lucille Packard, at one time chaired the board of directors of this organization, and they are, they've just been extraordinary partners of mine over the years in all of the efforts relating to children's hospitals across our country. So Matt, thank you for being here and for the support of the bills. We look forward to hearing from you.
Thank you, Congresswoman Eshoo, for your leadership on these bills. We could not do what we do across the country without the support that you've provided over the years. And you've been an essential advocate for children's health issues across the country for many years, decades. And we sincerely appreciate that. We appreciate your leadership and all that you've done. And we're going to miss you. It won't be the same. It won't be the same without you. But we know that you're working hard to pass the baton so that children will continue to have their voice in federal policy making. As the Congresswoman said, we've made tremendous progress over the last several years in treating kids with cancer. Their survival rate, as mentioned, is dramatically higher than it was decades ago. But we still have a long road ahead of us and a number of challenges. We have challenges with drug shortages, as was mentioned, with the level of funding for pediatric cancer research, and interruptions that continue to persist in the supply chain that are causing tremendous issues with not only research but provision of clinical care. Our nation's children's hospitals play a unique role in this country. Not only do they treat over 95% of kids with cancer, but that is also where the research is taking place. Every one of our children's hospitals conducts cutting-edge research, and it's in those environments where we really see some of the breakthrough therapies being developed, such as CAR-T therapy. So it's essential that we as a country continue to support our children's hospitals so that they can do the work that they need to do. But as also mentioned, we're struggling with development of those therapies when they are licensed to the pharmaceutical companies. So the population of children with cancer is dwarfed by that of the adult population. And so the same incentives to develop novel therapies for children just aren't as evident as they are with the adult population. And so this really does take a concerted effort, not just from on the state level, but on a national level, making sure we're advocating for the appropriate policies that will provide incentives for the pharmaceutical companies and others to continue to develop drugs and conduct clinical trials for kids. At the Children's Hospital Association, we're a supporter of these bills that have been put forth, and that we consider to be core to our role in educating lawmakers about the importance of these bills and making sure that we're garnering their support and helping them understand the unique needs of children. Children are not little adults. We don't treat them the same way as we do adults. And it's important to understand that when we treat a child, we're treating the whole family. The whole family requires care, and that is a unique role that children's hospitals play. So it's incredibly important for us to have an ally like Congresswoman Eshoo, and we look forward to working with her this year as she winds up her time in Congress, and look forward to working with her successor. So thank you very much.
Next, Dr. Tanya Gruber. She's the director of the Bass Center for Childhood Cancer and Blood Diseases at Stanford Medicine Children's Health. So Dr. Gruber, thank you for joining us this morning for your extraordinary work.
Thank you so much for giving me the opportunity to speak today. These bills, each and every one of them, are incredibly important. So as a pediatric oncologist, I face very distinct challenges when you compare that to my adult colleagues. And when I was looking through the bills, every one of them has addressed an issue that has impacted me over my years as a clinical investigator and as a physician. So when we run into drug shortages, what happens is we either omit that chemotherapy drug or we replace it with something else. And that's just not acceptable because that really compromises their care. It's been shown to lead to inferior outcomes, and we really need to ensure that there's sufficient drugs for the ones that we are using to treat our pediatric cancer patients that we know are effective. And you know, as was mentioned, children are not little adults. Some cancers are unique to children, distinct. These are cancers that are not occurring in the adult population, and there's really a lack of drug development for these rare malignancies. So ensuring that pharma has a duty to look at the development for drugs for rare cancers and even for other rare diseases, ensuring that there's a pediatric development plan is incredibly important. And the last thing I want to mention is we've made great strides requiring pharma to look at the pediatric population, but finding a safe and tolerable dose in pediatrics for a new drug is just the beginning. We don't treat children with cancer with a single drug. We use drugs in combination, and we need to have them take the next step and require them to evaluate these new drugs in combination with other drugs, which becomes the next treatment of tomorrow that will then improve outcomes. So, you know, they tell us that childhood cancer is a rare disease, but whenever I'm out and people find out what I do, I always hear, oh, my son or daughter had cancer. Someone in our family, their child had cancer. My friends, their child had cancer, or a classmate of my child. It really touches everybody. And we really need to invest in these children because these are the children of the future. These are our future nurses, doctors, CEOs, congresswomen. It's really so important to invest, and we really need to provide these incentives and requirements in order to lead pharma to invest, because quite frankly, it's just not profitable. So we really need these bills. They're so incredibly important. I'm so grateful for everything that you've done to bring these bills, and really happy with the advocacy work that's been done here at Stanford. And I'd like to make a call out to Dr. Link, who's very passionate about this and was one of the investigators that published on a trial that looked at what happens when you replace one drug for another in lymphoma and how that negatively impacted outcomes because of a drug shortage. So thank you so much for coming today and listening to this. It's such an important issue. Really appreciate it.
Just your voice alone is healing. To listen to that beautiful voice and your instructive words. Thank you, Doctor. Marissa Atat. Marissa's daughter, Rachel, received life-saving cancer treatment right here at Packard. And we feel really quite privileged that she would come and be with us this morning and tell the story. Marissa?
Your child has cancer. No words no parent ever wants to hear. Sorry. Yet in an instant, with a simple phone call, those words turned my family's life upside down for the next 2.5 years and changed our lives forever. 10 p.m., January 10th, 2005, I found myself lying full body on top of my screaming, very strong 11-year-old daughter. Her dad stood to her side, holding one arm, while it took 2 nurses to hold her other arm. Our daughter had just been diagnosed with leukemia, and all of this was so that multiple IVs could be started to give her the blood and platelets that she needed to survive the night. Later that night, as I climbed into bed with her, Rachel asked me, why are we doing these things to her? And I answered with the sentence that would become my mantra for the next 2.5 years. It's not a choice. Rachel was born with Down syndrome, and while she always led a full and active life alongside her 2 siblings, she did not have the same understanding as your typical 11-year-old might have of what was happening to her. The next morning, when the phlebotomist came into the room, we were all just trying to explain to Rachel, you've got to stay still. She interrupted us with 2 words, one time. She looked the phlebotomist in the eye, she held up her finger, and she said, again, one time. And that man, bless his heart, he looked at every vein she had available, and I can still see the sweat dripping off the end of his nose, because he had 2 hands for her, and darned if he didn't get her in that one time. From that moment on, Rachel took over directing her medical care as much as she could. She would walk into the lab, put her arm out, and when they would ask her if she wanted to look away, nope, she wanted to see every last drop that they were taking out of her. If all these things had to be done to her, she was going to let everyone know how she wanted them done. I believe this was her way of having some control over a very uncontrollable time in her life. As much as I can try to describe what it is like to watch your child go through chemo treatments and all that goes with them, side effects, medications to counter the side effects from those medications, endless hospital stays, and on, you have to live the experience to truly understand it. The best I can do is tell you that even with the fabulous care she received from everyone here, and it was truly stellar care, we could have not asked for anything better, it was and remains the most difficult time in our lives. Treatment for any childhood cancer is brutal and traumatic. It's traumatic for the child being treated, for the parents who are watching, and also for the siblings who so often have mixed emotions about what is happening to someone they love, as well as to their own lives. And it doesn't all just end when treatment ends. Going through such an experience impacts the whole family and their lives for years to come. 2.5 years after that first phone call, when Rachel finished her treatment, we all breathed a sigh of relief and wondered what had just happened. It took a while to acclimate to our post-cancer lives. One thing I did was to start mentoring parents for the Department of Family-Centered Care of children who were living in the hospital with cancer. Helping other families figure out how to do this crazy, unexpected, life-changing journey seemed one way to take our experience and turn it into something positive for other families. In so many ways, we were one of the fortunate ones. We were a family with many resources that helped us get through that time. In the last 15 years of mentoring parents, I have learned that there are so many different and challenging family situations. Most families are not as well resourced as we were. More often than not, I see parents who have little to no outside support, minimal to no health insurance, and employers who cannot or will not be flexible. When you hear those words, your child has cancer, your immediate thought is, will my child survive? Fast forward 8 years after Rachel finished her treatment, I get another phone call, this time from my sister, telling me that her 9-year-old granddaughter, my great niece, had been diagnosed with leukemia. I felt like I had been kicked in the stomach. Here we go again. Only this time the outcome was different. After having a stem cell transplant and living in a hospital for a full year, my niece was one of the children who did not survive. Our family was now not one of the fortunate ones. While childhood cancers have certainly become much more survivable over the years, there is still so much more that needs to be done. We need more research. We need meds that are created for children and not adults. We need to know that our kids won't have to wait for the medications and treatments that they need, that they will be available when they need them. I can't begin to tell you how inspiring these children who are fighting cancer really are, my daughter and niece included. With everything that is happening to them, they still have this amazing ability to deal with their cancer journey with grace and humor. That these kids can still laugh in the midst of everything blows my mind, and yet they still do. While my mantra of it's not a choice still applies for any child having to go through cancer treatments, how we as a caring community come together to support funding and research into childhood cancer treatments and medications is a choice. And I hope that we can all make the right choice for the sake of all our children. Thank you.
And that's the reason that we're here today. That's the reason that this place exists. That's the reason for the legislation. You know, if any one of you were to sift through the pages of the bill, it's all written in legalese. But as I often say to constituents, when that becomes law, those words walk into people's lives. So I think that better than myself, each person that was here at the podium today has made really the most eloquent case for why these changes need to be made. It's for the children. It's for the children. It's for the children. So I want to thank each one of you for taking the time and for getting behind the legislation, because this is must pass. This is must pass. So I'd be happy to take questions. You're good. Yes. Yeah. You're good to be here too. Thank you. Put the message out that this is all about fulfilling the hopes of really what needs to become reality. Anyone else? Thank you for coming. Thank you. All right.